Hello and welcome to all of our viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we're getting ready for our Tongue Tie Symposium of 2023 that's coming here next month. And we are very excited about this. It's always a symposium, 2 days full of information, everything related to the topic of tongue tie. And here with me today, I have one of our speakers, Ramya Kumar. Welcome, Ramya.
Thank you so much, Kristen. It's really exciting to be here and be part of this symposium.
And you are back by popular demand. You have been speaking for Gold previously, but this is your first time you're going to be in a live presentation, correct? At the symposium.
Yes, that is correct. I've done recorded ones before.
Wonderful, fantastic. So we are really excited to have you on board for this. But before we go a little further, for some of our viewers who are not yet familiar with you, tell us a little bit about your background. You have a very interesting background. You're a speech language pathologist specializing in infant and pediatric feeding, and you're also in the NICU. So tell us a little bit how all this came together. You know, were you a speech language therapist first and then you got interested in feeding, or, you know, the other way around? Tell us a little bit how that all came together.
Yeah, absolutely. So I am located in Phoenix, Arizona in the United States in the desert. And I am a speech language pathologist first. That is my primary license that I practice with. And speech pathologists, unlike the title, which can be misleading, we can specialize in feeding and swallowing across the age spectrum because we swallow and eat and talk with the same anatomy and physiology, essentially. So my specialty that has kind of happened over many years is within pediatrics, and then even more so within infants, and then even more so within the neonatal ICU setting with infants that are born prematurely as well, or medically complex. So that is where life has taken me and what I've specialized in. And through that, it has opened up kind of my world and my licensures and additional trainings to add different modalities, because I consider myself what I call a whole body practitioner. So I'm not limited to just the mouth. While we swallow over there, our swallowing kind of begins there, so much more happens in the whole body. So that's kind of where I expanded my knowledge base. I am also an international board certified lactation consultant. I was seeing a lot of breastfeeding dyads and co-treating with a lot of lactation consultants, and eventually kind of went down that path. I am a cranial sacral therapist. So again, that whole body lens, as well as neonatal touch and massage certified. So I truly believe what happens in the body happens in the mouth and the other way around. So that's kind of where I'm looking at a lot of things. And then with my experience in the NICU setting, and also when I was outpatient following babies that had a medically complex hospital stay, G-tubes, oxygen, tracheostomy, I was really opened into this world of the trauma that the babies and the children are going through, as well as the family, and then also the provider. I think as providers do a good job kind of shoving that under the rug or layering it, but we have to acknowledge that as well. And so then that led me along the pathway of getting certification and coursework in being a trauma-informed professional. And I work with tongue tie or tongue and lip tie releases, pre and post release, with one of the providers here in Arizona, and kind of have been supporting families through that whole journey and helping them make decisions of, is this the right time? Is it not? What else do I do? So that's kind of my whole lens, I guess, of how I approach these areas.
It's absolutely wonderful. I love how you mentioned that you are, you know, you're looking at the whole body, not just like we're not isolated. We're not just the mouth and the throat, right? So there is so much more going on. And I love how you put all these elements together, from cranial sacral therapy as well, you know, and then having this trauma-informed lens. And this brings me really to the topic now too, that you will be presenting on. I find it wonderful. And in recent years, we have become so much more aware of the word trauma and trauma-informed care, right? In all aspects of care. And I absolutely love that, because I feel like that opens new doors to how we treat, how we provide treatment not only to our little patients but also to the entire family as well, right? And not that long ago, it was like, especially in the NICU, that wasn't even thought of. It was always the focus on, obviously, the medical, the surgical interventions, medical interventions, the the pharmacology, all that kind of, all the procedures, and now looking at this trauma informed lens, because these little ones, they are experiencing trauma. It's not like as previously thought, oh, they won't remember this, right?
Yes.
They do. The body keeps score, really. I mean, right? And so here you are with the trauma informed care. What have you seen when you in your years of professional development and such, how things have changed for the better?
Yeah, that's a great question, Kristen, because even just in my time, I've definitely seen that evolution, and it's still changing, right? I mean,
Right.
We've had these concepts, I think, around, but it's becoming, starting to be embedded more into practice. But I think it's still, sometimes we still are living in the zone of the buzzword of like, we're doing trauma-informed care, or we're, doing family-centered care. But I also feel like I would love for it to kind of transition to where we don't have to think about what we're doing, and that's what we're doing.
Yeah.
That's basically our culture, right? And I think that's where I'm seeing it, or where I'm helping in my unit kind of, channel or champion change to be, this should just be what we do.
Exactly.
We shouldn't be having to say we are trauma informed, like that should just be our norm. And there's this big concept, especially in the NICU, and for me, is a practice I use throughout all my settings, because I have my own private practice as well, is this concept of doing with versus doing to. So it's a partnership, it's a collaboration, it's a moment to moment kind of check-in and pivoting and, engaging what's happening, but also beyond just the patient or even the patient dyad or triad, but what else is happening, right? There is way more to our families and our babies and our patients than just themselves and their caregiver. So I think that's where I'm starting to see a little kind of expansion happening. But also for me, a big passion area is, how are we taking care of ourselves? Because if we're not showing up with intention and we're not checking our own traumas that we all have, then we're going to live in that space of doing to, and then we leave, as opposed to doing with all the time. So
yes. Oh, that was so deep. I really, really like that. I really, really enjoy that, because we're always often taking ourselves as the care provider out of the equation, because we are we're providing care, we are working, to benefit the patient and the family. But the trauma we bring into too is another aspect, and that leads us to how we give care and what we're doing and how we're reacting sometimes, in certain ways. So if we don't address that, we're taking our trauma into how we, provide care, and that we're not of service then, right? That's not a good thing. So, and most of us are probably not even aware of that. That's probably the tricky part, right? Because everybody who comes into this has the best of intentions. We're all doing this because, we love what we do. We love the families. We'll have, provide the best possible care. So nobody comes into this, I believe, with bad intentions or bringing our own things into there purposely. So, here is like a lot of work to be done. So, right, talk about that, Ramya, because I feel like this is so big.
Yeah, I feel like in the healthcare environment, especially, right? So I always also go back to just the word healthcare, right? It's health and care, and health should be all dimensions, not just physical health, right? Physical, emotional, spiritual, mental. And I think, again, we're seeing a little bit of that shift back, and, the pendulum kind of swaying of what does mental health mean? What does spiritual health mean? And how does that manifest into physical health, and, the other way around? And we have to consider that as providers as well as receivers of care. And, I feel like we're so grounded with evidence-based practice. What does the research say? What does the literature say? That sometimes I think, or we're so process and protocol driven, right, to avoid error, especially in a hospital setting. But I think every so often we are missing or forgetting what does the human in this equation need in that moment. So yes, the evidence might say this, my protocol might say this, but is that baby, is that child ready for this? Is that family ready for this? Or do we need a pause? Do we need to check in and come back to it? So we need to be okay with that. We need to be comfortable with the uncomfortable, I think.
Yeah.
And I also, so as a speech language pathologist, right, I'm also a communication specialist. And that's something I try to remember is what are the nonverbals from the baby as well as the adults, right? What's happening and being okay with silence. We're not often okay with silence, but a lot can be said and heard in that moment. And so really just leaning into those, the space between our words to see what is happening there is where I feel like we need to just hone our skills in a little bit more.
The space between the words. I absolutely love that. Yeah, and your presentation is titled Trauma Informed and Family Centered Care. I didn't even mention that before. We need to talk about that. Keeping the family unit at the center of a tongue-tied treatment model. And I love that too, because keeping the family unit at the center, right? And you mentioned something that really spoke to me when you said we need to be okay with the uncomfortable and the silence. Because I feel like often families are confronted with information or decision making, and they don't get time to breathe, time to think, it's like often very quickly done, very without emotions, of course, because what you mentioned, we are evidence-based and protocols, right? And so keeping the family unit at the center and seeing what is right for them is so important and not always done. So tell me a little bit more about the presentation itself too and the topic.
Yeah, I was really excited when I was approached to talk about this topic because I feel like it blends a lot of my worlds together. And as I was thinking about it more, so I just kind of dug deep into even just my practice. And I think even prepping for this, I've been more cognizant and aware of like, what am I doing or not doing in my practice as well. But through the presentation, what I'm hoping to kind of get through is, again, what is the evidence behind what does trauma look like? And even that word can be difficult or challenging for people because we think about trauma, again, in a hospital environment as, blood, fire, surgery, all these big things, as opposed to cortisol release in our brain and how regulated or unregulated we feel from moment to moment. So thinking about that for where are we at as providers? Where's the family at? Something like feeding, which is supposed to be this bonding highlight of parenting and mothering moment that is now laden with all of these challenges and perceptions and all the like noise and chatter that, we might hear from, again, well-meaning caregivers, family members. How do we sift through that? Meet the family where they're at, see where they're at in their trauma cycle. Are they in this space of like good regulation where they can actually relate to our information and then reason through it? That's actually one of those pyramids I'll be going through. And some things like what is the trauma of a feeding cycle? And some of it is, okay, how do we maybe gauge where our families are at? But then how do we take that as providers and turn it into action steps? Because that's great if we feel good about the knowledge, but what can we actually tangibly take when we go back to our work environments and our settings in the next day or the next hour after the presentation? So some practical things to think about that parents have shared both in the literature. There's actually some very interesting literature where parents have shared quotes, as well as some shared experiences from even just my day-to-day practice that parents have shared with me that I then take to my next interactions.
Oh, fantastic. I can't wait for this, especially also the part where you say that you give us actionable items that we can actually take after the presentation, take that information, the knowledge, and really apply it directly. I absolutely love that. So Ramya, I could talk to you forever, really. There's so much to talk about, and but our time is tight here. So of course, we appreciate the time you spent with us here and making time in your busy schedule to come and see us here today. Before I let you go, what is your last nugget of wisdom for our viewers here with regards to this topic?
I think my big piece would be just kind of be okay leaning into your heart space and be okay with emotions. I think, again, as healthcare providers, we are taught or maybe even sometimes reprimanded, or
Yes.
it's a badge of honor that I'm resilient and I don't let my emotions show. And if I tear up, that's not okay. But it's okay because we're human. And I think we have to lean into our humanness to be able to connect with the other human that we're working with versus doing to. So I think just even coming to this, just be open to maybe finding some vulnerabilities within that kind of open our doors to be better, more heart-centered providers.
I love that. Leaning into our humanness, being more heart-centered providers. Absolutely love you. Thank you so much, Ramya Kumar. That was absolutely beautiful. And thank you for spending time here with me and being here. And we're looking forward to the presentation.
Absolutely. Thank you so much, Kristen. I'm looking forward to it as well.
And for our viewers, now this is the presentation of our tongue tie symposium that we will have here on September 11th and 12th. These are 2 days. You can either book them together and get the bundle, or choose one of the days itself. The first day on September 11th is all about the fundamentals, and September 12th, we're digging a little deeper in the advanced knowledge of everything related to the topic of tongue ties. So we hope to see you at the symposium. Everything is recorded, of course, if you cannot be there live on September 11th and 12th, but check all the information out on all the presentations that we will have available for you, and you can find out more at goldlearning.com. I hope to see you all at the symposium. Bye-bye, everyone.